Good morning, everyone, and welcome to day 2 of the Carer Knowledge Exchange Research Incubator for 2024, Sustainability and Caring. The theme for today is Financial Sustainability for Carers. My name is Tish Cronon, and I'm one of the Senior Managers at the Institute for Public Policy and Governance at UTS, one of the proud partners, along with Carers New South Wales and Department of Communities and Justice, one of the proud partners in the Carer Knowledge Exchange. I would like to acknowledge the traditional custodians of the land that I'm joining the session from today, the Gadigal people of the Eora Nation, and all the lands represented by attendees participating this afternoon. I would like to extend my respect to elders, past and present, and to all First Nations people, including any joining us here today. Please note that today's session will be recorded and shared for on-demand viewing. I'd like to ask you to keep your camera and your microphone turned off during the presentations, and you're very welcome to add questions and comments in the chat throughout the session. In fact, we encourage that, so we would really love to hear from you in the chat. We've already had, on day 1, we've had very lively and interactive chats, and that's been fantastic. Yesterday's sessions focused on sustainable carer support and were very stimulating for those of you that were able to join us yesterday. You'll recall just how stimulating and varied and diverse and compelling some of the work that was shared with you yesterday, the initiatives and the research. So for the past 3 years of the Carer Knowledge Exchange, activities have highlighted that financial sustainability is a central element of carer wellbeing, and hence the focus of today. It's so critical that we have decided to make it a full focus of the incubator. So in a similar format to session 2 yesterday, this symposium session will provide you with a brief taste of a wide range of research initiatives that capture the impacts of caring on financial wellbeing. We'll hear short presentations from 5 speakers with additional information about their work being shared in the chat, and thus we're encouraging you to engage with that. The presenters will interact with you directly in terms of sharing further information on the chats. Our aim with this symposium structure is to bring attention to the data that exists around carer finances and to highlight opportunities to apply and expand this evidence base. We hope it does spark some further investigations and research and discussions. Second session today, which will occur after a 10-minute break, will then give us all the opportunity to start applying these insights to policy and practice. But first up, we'll hear from Alistair Furnival, partner at Evaluate Consulting. Alistair presented on his work at the very first Carer Knowledge Exchange Research Incubator in 2022. And we're pleased to have him back, bringing a new perspective today. Alistair's background is in public policy, economics, and political strategy, and his work focusing on carers has explored the economic costs of caring. Welcome, Alistair. And I will hand over to Alistair now to present. Thank you.
Thank you. Thank you, Trish, and thank you to Carers New South Wales. As Trish said, this is to some extent a recap of work that we did back in 2022. Just to run everyone through the numbers again and talk about a particular thesis we have about why caring should be treated as work rather than as welfare. So calling it replacing welfare with work. Can I just ask, is everyone seeing a slide that says 2022 research at the top?
Yep.
Yep, good. Excellent. So essentially what we did was we took national population data, looking at family structure, age, sex, and other factors, and different incomes that people had. And we looked at the incidence of caring around the country and when people are called to care at what age, how many times during their working lifetime, and for what period. And we looked at the fundamental question of what is lost over a lifetime economically and privately for those people. So when I say private, I mean income to the individual and the family and the household, as opposed to broader effect from participation in the economy. So we looked at that on two measures. One, what is lost in terms of lifetime income, and secondly, what is lost in terms of lifetime superannuation as a consequence of time foregone in the workforce that they would otherwise do. And we call this the opportunity cost of caring. So economics is all about choices, and the opportunity cost is what would be the cost or the benefit of the alternative that you might take if you hadn't been called to care, or if you'd chosen not to answer that call for that matter. This all sits within a broad thesis we have in a public policy sense that caring should be treated by the Commonwealth Government in particular as work, not as something that is just necessary for welfare payments. But in saying that, we recognise that there are several constraints. So past reports that have been done have looked at things like what would it cost to employ people to do all of the work that informal carers do in the country. That always comes up with several billion dollars worth of extra expenditure, and runs into the usual problem at Treasury that simply the money isn't there. So we're trying to find a kind of middle path between the unreasonably low support that is currently given and what it would cost for formal care. So 3 pathways during the working life. People don't become a carer at all. People do become a carer at least once, and sometimes more than once. And a separate pathway that people become a carer with superannuation added to the carer payment only. And this, I think, has informed some of the campaigns that have been running around superannuation. And it's obviously a disappointment to us to see that the government's seen the light in terms of parental leave for superannuation, but not in terms of the carer payment. We can break down within that model about sex, age at which care commences, duration of care, so the episode, partnership status, which is incredibly important. Do you at least have one income in the house, for example? And the income at the commencement of care, so what is foregone? And then there's a complex economic model where for each of those pathways, there's 10,000 random entries to compare and find averages and different percentiles and such. So the impact of all carers, and this is in 2002 dollars, so you can up it by a couple of years, reasonable inflation. The average loss in superannuation for carers over a lifetime is $175,000, and the average impact on lost income is closer to $400,000. But you can see at the 10th percentile that some people do much worse than that, that the 10% who have the most impact lose 400-odd thousand in superannuation and close to $1 million in lifetime income, which is obviously very material for those people. And there is a tendency, if you look at this box and whiskers chart for the superannuation outcomes, the line in the middle of the box is the median at about $90,000 lost. But the mean is much, much higher than that, which says to you that there are very significant losses coming for a small group, a group of carers, a significant group, who have long episodes of care. And you can see down to the outlier there, some people are losing very close to $500,000 in superannuation. Similarly, the bias is towards worse outcomes away from the median. So the mean is higher than the median here, is closer to $400,000 in lost income. And some people are losing well over $1 million in lost income, closer to 1.2 or about 150 looking at that chart. So these are very significant things, that there's a cost of caring that is borne by the carers that is not being paid for by the government or in any way remunerated through in a reasonable way or compensated through the carer payment and the carer allowance. What have we done in this space? Sorry, my box is covering up the right-hand side of things, which is generally what I need to see. So I'm just going to move that. Generally, what you can see that's happened over the last 25 years is a lot more money has been spent on care in different ways, in aged care and in the NDIS and such. So the phenomena that matter on that chart are that if you look at the green box on each bar, more money has been spent on carers each year. It's just that relative to what's been happening elsewhere in the economy, and particularly the introduction of the NDIS and the growth of aged care, neither of which I think any of us would begrudge, carers are just falling behind in terms of parity. So we're spending more money on care, we're spending less money relatively on carers. And you can see this on a future projection here, that you have constant growth in the amount of money that is spent, particularly by the Commonwealth, on care as a part of the economy. But the money that's actually spent on carers is flatlining over that period. Sorry, I jumped the slide there. So we modelled a couple of options about what would happen. The first is what happens if you put the superannuation guarantee on the carer payment. That's good at the average. You spend about $52,000 to defray future costs of about $84,000. So even though it seems a lot of money that you're spending several $100 million in the first year in successive years, the average lifetime cost per carer is only about $18,000. And in any case, at the mean, you're saving money on the aged care pension and other pensions in the future. So spending money on superannuation is positive from the government's point of view. The challenge with that is people don't look 25 years ahead. They look forward on the forward estimates and say, well, it's a cost that we don't get back during that period. But that's always the problem with dealing with government. This is a fairly obvious chart which simply says that the impact of superannuation guarantee on the carer payment increases with the duration of care. That makes sense because there's more money going in and it's sitting there for longer and it's compounding. So you'll get the benefits out of it. The other things we looked at were increases in carer income. And if you refer back to our original report, which is sitting on our website under reports, and probably on the Carers Australia and Carers New South Wales websites as well, you'll be able to find that there. So the ideas were that you increase the carer allowance by 150% for those who get the allowance but not the carer payment. So we say nominally that that is lower intensity care. Or you increase it by substantially greater for those who receive the carer payment as well, because we take it that they are providing higher intensity care and therefore their economic loss is likely to be greater because the restriction on them working is likely to be greater. The argument on that, as say, if you refer back to our original report, is that historically carer payments were pegged to things like nursing home benefits as a fraction of that. So that they rose in concert with that. So we didn't get this problem where aged care funding is going up constantly, but carer funding is not keeping pace. And you can see various costs associated with that, but you can also see the impact on lifetime income. 99,000 does not defray 400,000, but it goes a long way to making things better. So coming back to the proposition and the context in which this takes place, we think the whole idea of how carer payments are made is unreasonable because what carers are doing is work and is at the cost to them of doing work, even though there's been a minor change in the number of hours you're allowed to work in the most recent budget. We think that because caring doesn't resemble other things that trigger subsidy payments, it's not occasioned by the individual receiving the payment, by which I mean the carer is not receiving the payment because they can't work. They can't work because they need to look after someone else who has a disability or other condition that needs support. And therefore, it is work in that sense. The only thing that probably resembles that is childcare by parents, so informal care of infants and children. The difference with caring is that with childcare, at least in a large number of cases, people have the opportunity to choose in advance and think what the fiscal implications of that care and having the child are going to be, and they make that decision accordingly. So there's no true selection. We don't set carer payments low as an incentive. This is part of the mythology that particularly in unemployment benefits, if you keep them low, there's no incentive not to work. I think they could go up very significantly before there was no incentive not to work. In any case, we don't do that with carer payments. And there's no implication that you otherwise can't find work. Again, that goes with the fact that it's not, the demand for care is not from the individual providing the care, it's from someone else. And we ought to be looking at how we find parity with formal care in that sense. Demand is random and unpredictable, but it has a tremendous bias towards women. I think it's 2.5 to 1 ratio, women to male carers, or 2.5 times greater. And it has a lower socioeconomic bias. People who have high incomes may choose to buy care rather than provide care themselves. And we know it's worked because we invest in similar things. We invest in the NDIS, we invest in hospitals, we train formal carers across the system, and the public opportunity cost of reduced informal care exceeds the subsidies. So what can we do about that? A few options that we haven't explored, and the two things we would like to do are update the current data, which can be done very easily and very quickly, but also look at some other options. The first is income splitting, which frankly is a good solution to most socioeconomic problems of this kind, which you might want to cap at a particular wage similar to the minimum wage or the median wage for Australian households. But it would recognise that there is work going on in the house, which is, which otherwise might be done by someone who goes out and earns and participates in the broader economy. We could look at a basic income payment. So if you look at the Home Care Package 2, it's about $50 a day. A reasonable fraction of that would significantly exceed current carer payments. Now, we run into willingness to pay and capacity to pay constraints at Treasury and the government. So how do we filter that? Well, you can means test that by saying, well, how much do you need it? Do you have other income in the household? Do you have other income yourself? And we already do that to some extent. We could have a trigger, which is length of care episodes. So people who care for a few months maybe don't get the basic income, but people who've cared for a year or more do. And we could have age-related solutions, which we do across a whole lot of government subsidies and payments. Because the issue of people, particularly young people who have their schooling or other education interrupted, is very significant and has a much more significant impact on them for whole-of-life income. And we haven't specifically modelled that, but that's something that probably needs a solution. Superannuation, we think, is a minimum. We've done the modelling on the carer payment. We actually think it should be closer to the opportunity cost, or at least at minimum wage for the time they spend caring. Whatever we do, and there are costs to anything you do, it's still going to be cheaper than buying the replacement formal care. So it's still going to be cheaper than the opportunity cost of what is foregone by carers. The choice to care has a number of motivations which aren't ever going to be just economic, and have things like love and duty and, in some cases, an absence of choice. It's never going to be fully compensated equivalent to work, but we think recognising it as a form of work and pursuing solutions that have a characteristic of work and remuneration for work is the right pathway forward. Thank you.
Thank you very much, Alistair. That was absolutely fascinating. And once again, even though we're revisiting, as you said, issues and data that we explored in 2022 that you shared with us, absolutely fascinating to hear it again. And I know it's generated a lot of interest on the chat. So thank you very much, Alistair.
Mm-hmm.
Our next presentation is a pre-recorded one from Dr. Mariam Nijad, a senior research fellow in the Centre for Health Economics Research and Evaluation at UTS, here with us. Her research focuses on inequalities in health and economic outcomes, and she is going to speak about some of her recent work relating to carers. So sit back and enjoy Mariam's presentation. Thank you.
Hi, thanks for all organizers for having me here. My name is Mariam Nijad. I'm a senior research fellow at the Center for Health Economics and Research Evaluation at University of Technology of Sydney. The work is co-authored with Payman Firzi Naim, which is my colleague here at UTS as well, and David Johnson from Monash University. This work was funded by Merck MSD and NHMRC Center for Research Excellence Value-Based Cancer Care. Just an overview of our work. and a bit of motivation. So we know quite a bit around the impact of childbirth on maternal labor supply. However, the caring responsibilities go well beyond these initial years. And these caring responsibilities, one imagine that would intensify if there are, complications, if there are health issues, etc. Here we are focusing on a very specific and substantial increase in parental responsibility arising from an onset of cancer in children. We find that mothers' labor supply and earnings significantly decline after their child's cancer diagnosis. However, we do not find any effect on fathers' labor supply and earnings. Just to give you an idea, when a child gets cancer and they do need chemotherapy, which is a population we are focusing here, on the horizontal axis shows you the first month of chemotherapy, 2 shows 2 months after, 3 months after, and so on. And on the vertical axis, you're seeing the average number of health services visits out of hospital per child, and this is the average in the population we have per month. So this is quite a lot of, number of engagement with the health services. And this is just to give, and of course, the caring responsibilities go well beyond just attending the healthcare. And you can see that it goes on for quite some time. So it starts a few months before the start of chemotherapy, and then quite a few months after. So it's a big chunk of time that requires an intense level of care. Or healthcare, and this, of course, we all know that goes along with other types of care required. The data we're using here comes from PLIDA, which is administered by Australian Bureau of Statistics, which basically links administrative data across different sources across the Australian population. So we start with a universe of children between age 4 to 25. That receive chemotherapy sometime between the age 2012 to 2023. We capture this data from the pharmaceutical data source. We link these to the census responses of these individuals, and through this we find who is their we link the children to their parents, and then we link the parents' information to their tax returns across the similar years to get the parents' labor market outcomes, earnings, etc. What do we find? We find that upon start of cancer, the mother's labor market labor earnings decline, or income declines by about 9% of their pre-shock salary, which is around $5,000 a year, on average, compared to the control group, which is, parents of children that their children haven't had cancer. So we look at the same population of children, but their fathers, and we do not find any impact on their father's income. Then we look at the parents of children that they do get cancer, but the children below the age of 10. We see that the impact on the income almost doubles for the mother. So we see a 20% decline in the base salary. And as you can see, it takes quite some time. It takes at least 2 years or so before this bounces back. So it's a stretch of time where this detachment from labor, or lowering labor earnings happen. We do not find any impact for parents, for the fathers of children less than 10. And, as I said, so we do realize that by comparing the children that they do with cancer below age 10 and above that, we realize that the majority of impact is coming from those younger children, so that they require a lot more intensive care from, however, there is still about 6% in decline for even parents of older children. again, do not find anything for fathers. If you look at labor market, if you look at the single moms, they do find also a 9% decline in the base salary. But what is important is that in the case of single moms, the length of time that the decline persists is longer. So it seems to be 3 or 4 years before they bounce back. If you look at the likelihood of working, we see that mothers are likely to drop engagement at all with any sort of labor market or work outside home by around 4 percentage point after the diagnosis of cancer in their children compared to the baseline. Do not find any results for fathers. This is much more, about 10% drop out of labor force for mothers of younger children. Again, nothing for fathers, and a bit less for parents and for mothers of or younger children. I very quickly go through family characteristics and work characteristics. So in families that fathers do very little in housework based on the responses to the census prior to the cancer diagnosis, we do find that the impact on moms are much larger. Also in more traditional, let's say, families where fathers earn a lot more than moms, or families that fathers are much older than moms, this impact is much larger in these sort of families. Also, if you look at the firm impacts, how the workplace of mom has an effect, we do find that female managers seem to alleviate some of this impact for moms, and also working in places that are generally or let's say in a high skilled sectors of the economy, this impact is a bit alleviated. This could be associated with some sort of other supports available at work. This just shows that this impact basically of cancer goes well beyond just medical treatment. There's a lot more involved, not only for the individual, but for their families as well. This is here, we are looking at the case of a child with cancer, but in my other work, I'm looking even, on other aspects of this as well. And we do consistently find that the families well beyond just individual cancer get impacted. And so there is definitely a lot of room for providing more support for families that are going through this awful thing. Thank you so much for inviting me.
That was absolutely fascinating. So thank you very much, Mariam, even though you're not live with us today. We really appreciate those insights. Thank you so much. Okay, our third presenter is Dr. Lucas Hofstadter, Senior Research and Development Officer at Carers New South Wales, where he coordinates the National Carer Survey that Carers New South Wales leads every 2 years with the support of the state and territory carer organisations, and collaborates with a range of external researchers to conduct and translate research on carers. We're thrilled to have Lucas with us today, and we're looking forward to hearing from you. Over to you, Lucas.
Thanks, Tish. Thanks for the kind introduction. As you said, I am going to present some evidence from our national survey, which we run every 2 years. So you can see this data is also from 2022. And at the end, I will have an appeal to add to our 2024 survey. Similar to what Alistair already presented on, just a quick overview of the economic contribution of carers. Here, that's the replacement cost of care, estimated in 2022 as 77.9 billion. That would be the cost to replace the 2.2 billion hours by all carers with professional formal care services. Just for comparison, in 2023, so you could add a few more dollars to the 77.9 billion. The aged care expenses of government were 28.3 billion. the government expenditure on NES was 37.4 billion. So you can add these two together and throw in a bit of more money, and then you add the replacement cost of care. Then you add, that's just to contextualize the economic contribution of carers. However, this economic contribution of carers does not occur in formal labor market settings, as we know, which leads us to the point that carers have, despite their economic contribution, a real diminished income due to the challenges of combining work and care and to the increased costs that many of them incur, be it co-payments for treatments, the cost of transport of the person they care for to treatments or therapy, housing modifications, all these things, they cost extra. Many carers pay for them. At the same time, their labor market participation is significantly lower than people who don't care. That's not surprising. So while non-carers, the male non-carers of the age 15 to 64, we've got 85.4% labor force participation. For men, with primary caring roles, that's 58%. Similar to women with primary caring roles, also 58.9%. And women without primary caring roles, it's 75.9%. This leads to the fact that 24% of all carers have a government pension or an allowance as their main source of income, which is relatively high. So that's not just primary carers, that's all carers, regardless of the intensity of their caring role. 24% of those have a government pension or allowance as their main source of income. Like I said, the data that I'm going to present, and I'm trying to be short, is from the National Carer Survey, which is conducted every 2 years. It's funded by the New South Wales Government. It's a national survey since 2020 with the support of the other state and territory care organizations. It informs our organizational direction, and it helps us to understand what carers do want and need. In 2022, we had 6,825 valid responses, which is quite a big survey. And on the right, you can see sort of the typical respondent profile of this survey, which is a female carer in her late 50s who cares for her child, including other children living with a disability. She lives in a metropolitan area and provides care for 104 hours per week. Now, this is this ideal, not ideal, but this is the average respondents to our survey, which should not gloss over the wide variety of caring situations that we capture with this survey. One of the main results that we found in our survey was that carers are very likely, and following up from the presentations before, carers, this is not surprising, that carers are very likely to experience financial hardship. We measured that through a set of indicators that were developed by the Australian Bureau of Statistics, and that ask for experiences such as, in the last 12 months, would you have been able to raise $2,000 in a week for something important, such as car repairs or house repairs? Did it happen that you spent more money than you received in a month? Did it happen that you couldn't pay a utility bill on time? And so on. So there's a set of these experiences that we ask about. And the result is that only 42.6% don't have that, have any of these experiences, which in turn means that 60% of all respondents to our survey experience at least one type of these financial stress experiences. Very worrying indeed is the top one that has been experienced by at least by more than a third of our respondents, which is that they were unable to raise $2,000 in a week, because this is indicative and sort of adds on to Alistair's presentation. This is indicative of very low savings that carers have and very low funds that are accessible for emergencies. Now, if we break it down by the financial support that carers receive, we find that depending on the payment, that for carers who receive some form of government support, the rates not only remain very high, they go up from the average in our survey. So we see that for those who receive the care allowance, 2/3 have at least one experience of financial stress, and 1 in 5 has 4 or more of these experiences. Of those who receive the carer payment, 3/4 have at least one experience, and almost 1/3 has 4 or more of these experiences. 4 or more experiences means that they're in severe financial stress, basically. Unsurprisingly, for anyone who followed the discussion, 86% of carers receiving a job seeker payment have at least one of these financial experiences, and very worrying, if the carer themselves receive the disability support pension as a source of income, almost 80% experience financial stress. One thing that always strikes me about these results is how jaded you get when you look at it, and when you see, oh, the age pension, 60% do not have financial stress, which means that 40% of carers on the age pension have financial stress, and that's way too high in my opinion. It goes a bit better for those who do not receive a Centrelink payment as their as income, which means that they're usually in work, that they're mainly, so these are carers who are engaged in the workforce, where it's also 45% who have at least one experience of financial stress. So we see these are quite worrying numbers that come out from our survey, which has a quite substantial sample size. So it's not, it's quite thorough and quite shocking information. But what does this evidence actually show? And I'll just leave it at that in the hope that we can, in the second session, have some discussion about this. This evidence shows that the majority of carers experience financial stress. 1 out of 6 of all respondents and 1 out of 3 of those receiving carer payment are in severe financial stress. As Alistair put in more economic terms, there's a need for significantly improved financial support for carers. And there are likely long-term impacts of financial impacts of being a carer on savings, on superannuation. Alistair presented excellent data around a simulation that shows long-term outcomes of this. Where we do need more evidence is we need more robust evidence on the population prevalence, on the duration, and on the frequency of financial hardship. Our data here is just a cross-section of 2022. We are starting to collect data for 2024, and we have collected similar data from 2020. And the shocking thing was from 2020 to 2022, these numbers actually increased. We're looking forward to seeing how over the last 2 years the situation has changed. But we are a carer survey. It would be good to have more robust data that is truly collected on a population level, with identifying carers relative to the rest of the population. We do need better data on long-term financial impacts of caring and superannuation and retirement. Again, Alistair's simulation data is excellent, but there's a clear lack of empirical data because many long-term data sets are not very good at identifying carers. And what we also need to know is how do these experience of financial stress in the long term and in the short term impact carers' ability to meet their fundamental needs on housing, on food security, on social participation. Because who's in financial stress, we assume, will feel their impact on exactly these things. And that is, we need more data to show what these impacts particularly are. So I'm ending with an appeal to help build that evidence base by supporting the next National Carer Survey. It says here it launches on the 1st of June to the 31st of July. If you go and visit nationalcarersurvey.com.au, you might discover that the questionnaire is actually already open. And if you would like to contribute, we would really appreciate your contribution to extend the evidence base for 2024. Participants can win gift cards. we can also supply you with paper copies of the survey if you would prefer to answer this very long survey on paper. I hope I stuck to time. Thank you very much. It was a bit rushed, but I will end here, and thank you for having me.
Thank you very much, Lucas. That was fascinating. And yes, please promote the use of the survey amongst your colleagues and any organisations that you think it would be useful for. So that was absolutely fascinating. And yes, very interesting to see the synergies between your data and those that Alistair shared with us. So fantastic. Thank you, Lucas. Our next speaker is Elise Kane. Elise has a background in policy and advocacy and leads the New South Wales Council of Social Services, NCOS, work on the social determinants of health and health equity. Elise will be sharing some of the care-related findings from the cost of living survey that NCOS regularly conducts, and very pleased to have Elise with us. We already have a really great partnership with NCOS around these findings, the cost of living survey. So I'm very pleased to see her present today. Thanks, Elise. Over to you.
Okay, so thank you very much for that introduction, Tish. I just want to quickly acknowledge that I'm living and working on the beautiful lands of the Wongal people and pay my respects to their elders past and present, and also my respects to any First Nations people online with us today. So as mentioned, I am going to be taking you through a snapshot of our annual cost of living in New South Wales research, which we do with in collaboration with UTS. It provides a snapshot of household budget priorities, expenditure on essential goods and services, and the extent of financial stress and hardship experienced across New South Wales. The 2023 research surveyed 1,134 people living on low incomes or below the poverty line across New South Wales, of which almost 1 in 5 were carers. So this is a representative sample, which also enabled us to look at the results by SA4 level and compare results to our 2022 research. We also held focus groups and in-depth interviews and had a focus on challenges faced by CALD communities, and our next annual research, which we've started for this year, will focus on single parent families. And I think this will be interesting from the perspective of carers, as we did find in our 2023 research that single parents were the most likely cohort to be undertaking unpaid carer duties and also more likely to be receiving carer payments. So unsurprisingly, the rising cost of living is having a significant impact for New South Wales carers on low incomes or those living below the poverty line. Compared to 2022, we've seen that there are increasing numbers of people reporting that they're struggling to pay for things like housing, for food and for medicines, and that they're having to cut back on a range of essentials. So you can see from this table that after single parents and First Nations people, carers were the third highest cohort to be affected by specific types of financial hardship. Our research found that carers are significantly more likely than the overall population to be struggling to pay for their utility bills on time, travel for essential reasons, including work or healthcare, to pay for mobile data or internet at home, and also to pay their mortgage or rent on time. We also found that almost a third of carers were struggling to make minimum payments on their credit card, and that they were significantly more likely not to have any funds set aside for emergencies, which was the case for a whopping 73% of carers, and really echoes what Lucas was talking about in his presentation earlier. You can also see from this chart that the most common areas of household expenses reported to be under pressure by carers are utilities, followed by food and drink and transport costs, and then followed by housing costs. And in regards to housing costs, it's really important for us to note that the research found 60% of carers are spending more than a third of their income on housing, meaning that they're living in housing stress. And over a quarter are spending more than half of their income on housing, meaning that they're in extreme housing stress. So we know that carers are facing significant housing affordability issues, and that they're needing to make really difficult choices like changing housing arrangements due to cost pressures. So, for example, our research found that majority of carers had experienced a rent increase in the past 12 months, with almost 1 in 5 needing to move house due to cost, and over 1 in 10 moving in with family or friends. Even more concerning is the fact that more than 1/5 of carers reported having their home severely damaged by natural disasters or extreme weather events, and this was significantly higher than the overall sample at 12%. And of these, over a quarter had to spend between $5,000 to $10,000 on repairs. Over 1 in 10 spent $10,000 to $20,000, and 1 in 6 spent over $20,000 on repairs. And just a reminder that these are carers who are on low incomes or living below the poverty line. So these are huge amounts of money for anyone under the normal circumstances, but particularly for this cohort of the population. When it comes to making sacrifices to manage cost of living pressures, households with carers are significantly more likely than the overall population to forego essentials across several categories when facing financial difficulties. So you can see from this table that a large majority of carers are going without personal care services, that almost half are sacrificing prescribed medication or healthcare, and around a third are skipping meals and going without essential hygiene items. So this table shows the different ways that carers are trying to make ends meet. And I just want to highlight a few key things here. The first being that carers were one of the cohorts most likely to have sought some form of financial assistance in the past 12 months, significantly higher than the average at 80%. And also that half have had to seek assistance from family or friends. They've pawned something for cash, and a third has sought assistance from welfare or community organisations. And these can be really difficult choices to make, and can be very stigmatising experiences as well. And I think really demonstrates the lengths that carers are going to just to keep the household running. I also just want to draw attention to the fact that more than half, at 57%, used buy now, pay later services. In fact, 29% of carers used them 4 or more times in the past year, just in order to buy essentials. And I think this reliance on credit is even more concerning when we recall that earlier I mentioned that almost 1/3 of carers are unable to make minimum payments on their credit cards. And carers were also more likely to rely on government support payments as their sole source of income at 29%. Carers reported that the stress and anxiety associated with the additional cost of living pressures were taking a significant toll. They're feeling, more depressed and stressed than they have ever been before, and that this is, really affecting their mental, emotional, and physical health, as well as their personal relationships. So, for example, we found that more than 1 in 10 carers were reporting never visiting or receiving visits from family and friends. And over 1 in 5 have reported that they did not do indoor or outdoor activities with family or friends. And I'll just wrap up this snapshot of the research with a quote from one of the carer research participants who describes running around the house to turn off all the light switches. I wake up in the middle of the night and remember I need to turn off the dishwasher. Whatever I do, I have to save money. I have to budget for it. Now, we know that there's a range of things that the New South Wales Government needs to do to address these issues, including boosting housing supply, making rent and transport more affordable, improving food relief and subsidies for low-income households, as well as, of course, advocating to lift income support payments. Just a final note that, as I mentioned, we've commenced the cost of living research for this year, and overall preliminary findings are showing that the impacts on most cohorts have worsened in the past year, including for carers. In terms of gaps, however, the research does need a caveat that it's unlikely to capture the experiences of those facing challenges with digital literacy and digital disadvantage, as it's conducted via an online survey. So there is a gap in knowledge regarding those that are not captured by the data. And I think what we also need a clearer picture of is how these cost of living pressures are directly contributing to flow-on impact to our systems, and also how the long-term impact of the rising living costs will have on people's health and well-being, and how that will play out into the future. Thank you for your time.
Really fantastic, and is giving us, coupled with the other data that's been shared today, is giving us just a really compelling story. So yeah, that was just fantastic. Thank you so much, Elise. Our next presenter, our final presenter, is Dr. Joanne Cummings. She's a Senior Research and Evaluation Officer at Red Kite, an organisation supporting families living with childhood cancer. Joanne's background is in social research and evaluation in both the academic and not-for-profit sectors. So she has a fantastic perspective to share with us today. And I'd like to invite Joanne to share her work with us now. Thank you, Joanne. Over to you.
I'd also like to pay my respects to the traditional owners and custodians of the lands on which I am joining you from today, which is the lands of the Gadigal people here in Sydney, and pay my respect to their elders past and present in acknowledgement of Reconciliation Week this week. I feel like this presentation is going to kind of tie up and give like kind of a case study or an example of all the different things that the presenters have been talking about this morning. So I'm talking about the financial toxicity of caring for a child with cancer, and I'm just going to give you a little bit of background to what it's like dealing for families that have a child with cancer, and then go through some data that Red Kite has collected over the years. Next slide, please, Cindy. So within the context of Australia, we already know that the cost of living is putting a lot of pressure on families, and we've heard that this morning. But when you add in like a child with a chronic illness, you have the extra cost, just like we heard in Lucas's presentations and from Elise's presentation, such as, you've got to travel to and from the hospital. There's extra accommodation. Sometimes you have to live away from home, so you might be supporting 2 households at the same time. And we know that there's often a significant reduction in household income as one or more parent have to give up work and become the unpaid carer. And that's what we heard in an earlier presentation about. That's often the mother's burden, and it's like that motherhood penalty is coming in there. And then on top of that, you've got this financial toxicity where, as McLean says in this quote, there's this blind spot within the medical model of healthcare, and self-concern, and there's like an increased risk that some of the more vulnerable groups in society, such as we heard today, that people in the lower incomes, single-parent households, or people living in rural and remote areas. So there's a real risk for them of that financial toxicity. Next slide, please. So at Red Kite, we provide financial assistance to help ease some of this pressure for families, but it's not a lot. And the financial assistance we provide help with paying utility bills, with rent, that kind of thing. And then in between the 1st of January 2022 and the 31st of March 2023, we supported around 1,700 families. We provided over $2 million, nearly $2 million in support. And we found that around a quarter of the families that we were supporting were living in regional remote areas. And we also found out that 85% of individuals were receiving additional supports from Red Kite. So we don't just provide financial assistance, we also provide psychosocial support, counselling, and those kinds of things. And financial assistance is one of the ways that families first come to us. Oh, sorry, so next slide. What Red Kite does to assess financial hardship, so we have a self-assessment for families to look at, the financial hardship and the costs that they're incurring and what's happened since their child was diagnosed. So as Lucas said earlier, we see increasing in the costs of food, especially for families while they're staying in hospital. There's increased costs, as we've already heard this morning, around, travelling to and from the treatment centre, that relocation again, hospital parking. Hospital parking is the big one, and anyone who's, had to go to hospital knows that it's very expensive. And of course, medication costs on top of that. And when we look at the data over time from what Red Kite has collected, we find that these costs are increasing and continuing, and these expenses are continuing for our carers. Yeah, and that's only just getting worse with the cost of the increased cost of living. Next slide, please, Cindy. So this is just the last slide to wrap up what we do. So within our self-assessments, we also ask our clients to indicate whether they have experienced a number of financial stresses. And so this is using the Hilda survey data, which is what some of the other presenters have talked about this morning. And we see a substantial a proportion of our clients are unable to pay for expenses such as utility bills and school essentials. And we can see how the cost of cancer has also impacting on other members of the family beyond the diagnosed child and the parents, so siblings as well. And we can see there that 47% of our clients during that time period had experienced psychological distress, which was impacting them because they were unable to pay for utility bills. So it goes beyond just the money into a psychosocial as well, and people's well-being, just as Elise was saying before. Yeah, and this is increasing over time, as we see with our carers, and more demand then on Red Kite's services and for other financial assistance support. So childhood cancer, as we know, presents a significant financial challenge for families, and this is just getting worse with the compounding interest of inflation and the cost of living in society in general. And there really is we really need to call out for more assistance from the government to help carers and to provide assistance, especially for families of children with chronic illness, as we know that they do not have, sometimes they're not eligible for Centrelink payments and things like that. So it'd be really great to hear in the discussion this morning in the workshop coming up about how all of this ties together. Okay, thank you.
We have exhausted our time, so what I'm encouraging people to do is to pop any questions. We won't be able to have live questions now because we've reached our time. What I would encourage you to do is to pop them in the chat and any comments that you have, because these will be able to be explored in the next session. And so I'd like to thank all of our contributors to this morning's symposium session. You've provided us with a wealth of information for further discussion and further exploration. Thanks very much.